fusions. So spine surgery is painful, and dealing with postoperative pain is a challenge for all parties involved. Oftentimes, it requires large doses of narcotics to optimize pain control, which we know is associated with opioid dependence, constipation, post-op delirium, respiratory depression. And so finding a way to mitigate that pain is of value to all of us. And so utilization of NSAIDs has historically been met in orthopedics or in spine surgery with some degree of hesitation due to delayed arthrosis or potential pseudoarthrosis or delayed union. But recent literature suggests that maybe some anti-inflammatories around the perioperative setting may not affect fusion rates as much as we thought. Prior to starting this project, we kind of did a little bit of an internal literature review and pulled articles that discussed spine fusion and anti-inflammatory use. As you can see, the results are very mixed and inconclusive. There are plenty of studies that say that we should not be using anti-inflammatories in the perioperative setting, while there are some that say it's safe. Which led us to ask the question, is there a safe and efficacious role for anti-inflammatories in the perioperative setting around spinal fusion surgery? This study was a large database analysis. Specifically, we looked at Part D of Medicare, and we used to identify patients that were 65 years and older who underwent spine surgery from the years of 2016 and 2019. One of the strengths of this study is its size. Total patients included were over 243,000, and we broke it into two cohorts, no anti-inflammatories and anti-inflammatories. The no anti-inflammatory group had about 136,000 patients, and the anti-inflammatory use had just under 107,000. We defined anti-inflammatory use preliminarily as if they were going to the pharmacy and filling a prescription within 90 days before surgery or up to 365 days after surgery. And then we looked at not only the 365-day pseudoarthrosis rate, but we looked at other variables such as the 365-day mortality rate, readmission rate, and then the 90-day complication rate. Complications being complications that were not leading to their admission, that were also not pseudoarthrosis. And then we looked at it a little bit further and dove a bit deeper and looked at if there was a difference between selective or non-selective anti-inflammatories and the risk of potentially causing pseudoarthrosis in our patients. It's kind of a busy slide, but these are the demographics that we included, but we essentially controlled for variables that were age, gender, race, and medical comorbidities. And our results were interesting. The patients that used anti-inflammatories in the pre- and post-operative setting were associated with a reduction in mortality at 1 year with an odds ratio of 0.3, though they did have an increase in readmission with an odds ratio of 1.05 and did have a greater rate of pseudoarthrosis at 1.21. We saw no statistical difference in the 90-day complication rate. This is a scatter plot diagram, just kind of visualizing what I just mentioned, but if you look, you notice that for all of the patients who took anti-inflammatories after surgery, you do see an increased trend towards pseudoarthrosis with their consumption of anti-inflammatories. Similarly, you can see a trend that with increased use of pre, post, or pre and post anti-inflammatories at all those time points, you have a 1-year readmission rate that's increased. And with regards to mortality, we see that the patients who took post-operative anti-inflammatories, we did see and note that post-operative reduction in mortality. With regards to the selective versus non-selective cohort, we saw that for the selective anti-inflammatory consumers, there were greater rates of readmission, complication, and pseudoarthrosis at 365 days. So increase in all across the board for all of those selective anti-inflammatory users. There are some limitations to this study. For starters, this is an observational study, and just due to the structure, has some inherent limitations. We recognize that some patients may be obtaining their anti-inflammatories outside of the Medicare system, which is clearly not tracked in our data set. We also assume that if a patient is going to go get a prescription from the pharmacy through Part D, that they're actually going to take it, which is something that we can't control for either. And finally, this analysis excludes patients who did not receive Part D Medicare, which to some extent makes this which is less generalizable than kind of what we would expect with a full Medicare population. But in conclusion, Medicare beneficiaries who underwent spinal fusion surgery and utilized NSAIDs was associated with greater rates of readmission at 1 year, higher rates of pseudoarthrosis. We did see a lower mortality rate, but no difference in complications. And then with regards to selective anti-inflammatories, we saw higher rates of readmission, higher complication rates, and increased pseudoarthrosis rate. So thank you to the rest of the authors on this abstract and manuscript, and to the rest of the University of Utah Research Department. Thank you guys for having me.
I will talk a little bit